8 tips to get rid of any pain. Pain is complex, it's a big topic, but there are some general rules that form a good basis for navigating your way out of most aches and pains in the longer term. Rule 1. If there is no major medical issue, assume there is a weakness. If all your scans and blood tests come back clear, you probably have some kind of weakness or another. And if you do, a major part of the solution will be strength-based rehab. The only note of caution is that, if the tissues are inflamed, they may not respond to strength work, without a bit of treatment beforehand. Pain treatment is a bit like dental care, sometimes you need to get through the treatment side of things before you can work on the big picture. Rule 2. Be willing to think outside the box. If you have been doing the same old treatments for a long time, and you aren't seeing progress, be willing to try out new things. Doctors are great, mine saved my life once, but the fact is only a tiny part of their training relates to pain management. Physios are great, but sometimes there is more to pain relief than exercise prescription. Chiropractors are great, but not all pain comes from the joints. Osteopaths are great, but not all pains will respond to a gentle approach. Flexibility and open-mindedness are essential qualities when it comes to working with stubborn pain issues. Rule 3. Start with what makes most sense to you. The start point of all healthcare procedures that involve a conscious patient are the decision to give consent for a procedure, because it makes sense to them. Find a practitioner who views things in a way that makes sense to you. If something doesn't sound right to you, get a second opinion, and a third if necessary. If, however, you know that you glaze over around health talk, find a friend or family member who knows their stuff and ask their advice. Or just base your decision on whether the practitioner seems qualified and sincere. None of these principles necessarily mean you will have definitely found the right practitioner. There is, however, a knowing, in most people about their pain. The majority of us are able to tell when we are being given an accurate assessment of what is causing our pain. Rule 4. Assume that there is scar tissue if it's stubborn. If you have a chronic pain, it's possible that you don't have any scar tissue in the painful area. So many people do, though, that you are better off assuming that there is scar tissue and finding someone who is qualified and interested in looking into it for you. If it turns out there isn't any scar tissue, at least you have ruled it out. If it turns out you did have scar tissue, releasing it is often transformative. Countless people with stubborn pain have unseen scar tissue. The good news is that there are simple ways of working with scar tissue that are helpful for many of us. Rule 5. Keep moving within reason. Research has shown that people who stay active have less pain, recover faster from pain episodes, handle pain better. The trick to benefiting as much as possible from movement and exercise for pain is to follow the golden rule. A bit of pain during a workout is okay, a bit of pain after a workout is okay too. If, however, you find that a certain activity is leading to an overall worsening of your pain for days after the session, that's a sign to back off that activity for the time being. Rule 6. It's never just old age. No matter what age you are, and what pain you may have, your pain is not caused by your age. There are always a million other people the same age as you who don't have the same pain. The good news is, it's never too late. I have personally seen 90-year-olds have legitimate pain breakthroughs. Even when you're 95 and you have a sore hip, guaranteed there will be other joints in your body that aren't sore. Those other joints are the same age. Think about it. Rule 7. Always be as conservative as possible. It's surprising how often qualified doctors and surgeons overlook this rule. The principle is this: always choose the least risky option with the fewest side effects. It makes no sense to take toxic anti-inflammatories if a massage or a chiropractor can give you relief. If there's even the slightest chance that rehab will prevent you from needing surgery, try that first, and only consider surgery down the track if you have to. Rule 8. Deal with your stress. Cognitive behavioral therapy is now officially part of the international guidelines for managing back pain. Research has shown that stress and trauma can play a role in stubborn pain. The way in which we choose to manage stress and resolve trauma is up to us. There are many possibilities. 3 possible options that have been very helpful for many have been Wim Hof method, flotation tanks, and Hakomi method. With the right mindset and the right tools, the overwhelming majority of pains can be managed in one way or another. Give us a call at City Chiropractic on 04 385 6446 to make an appointment now.